My name is Khaled Helmy. I'm the lead psychiatrist of the Seconia Recovery London. Um, I got my bachelor degree in 1996 in medicine and general surgery, and 2001 I got my master degree in neuropsychiatry. 2009 I got my doctorate in psychiatry and behavioral disorders. I'm a member from in the Royal College of Psychiatrists since 2013, so almost 10 years from now. I'm also the international member and the ambassador of the American Psychiatric Association since 2014, and a member of the International Society of Addiction Medicine as well. I decided to be a doctor because it was my dream since my childhood. Um, I was always fascinating about the human biology and the different interactions in our bodies, our mind, our health. Especially my mother was a great person, and she was a biology teacher, and she was my teacher in my early years. So that's why she maybe she taught me things related to the biology. That's why I love biology. And my father was a chemist, and he's dreamed to be a doctor. And so it was both personal aspiration and to understand more about the human biology and maybe dedication to my parents. I was always known by my friend as a good listener. So all my friends always came to me, disclose about their problems, ask for help, to support, for advice. So I usually like to listen to people. And also, I was confronted with some school mates and colleagues that were bullied, unfortunately, at school because, for example, they were socially anxious, not able to express themselves in front of the teacher and other schoolmates. And also, some of them maybe we have suffered from stuttering or stammering for a reason or another, and then again subjected to bullying. Others, which are now I understand, they may have some autistic traits in where they're at school, or being hyperactive with ADHD at school, and it's always put in the naughty corner, being subjected to discipline, and definitely that affect their mental health and even their career. Although they're very smart, but because of the continuous disciplines, affect their career. So it's always an aspiration to try to help um, those people. So I was always dreamed to help people to achieve or put a positive impact in their lives, in improving their lives, and to change the stigma related to their illness or their mental health or the problems they were suffering. So this was the main reason for me, to choose to be a psychiatrist. I think the most rewarding in my job is to visualize or oversee the positive impact in patient's life. And when you see a client, when they came the first time, being overwhelmed, stressed, anxious, depressed, maybe suicidal, and then after a while of maybe medication, some psychotherapy, and to find them like feeling better, achieve better in their lives, and try to enjoy back to the community, enjoying their lives. I think definitely that's really highly rewarding for me in my work. And also, it's highly rewarding for me is to change again the stigma. That's why I was involved in many awareness campaigns to help clients, especially with mental health, disorders, especially with adult ADHD as well, because there are huge potentialities in the client with adult ADHD, which unfortunately they were underexpressed in the community because of the ADHD. So being again up to date with all the new researches and guidelines regarding treatment, and preparing presentation and talks in national and international conferences related to these topics also is highly rewarding for me. While I'm seeing changes not only in the patients but also maybe in the changing the guidelines or the protocols in some countries, which I was involved personally in providing some protocols for different treatment in addiction and mental health and ADHD in different countries. think the most common comments I hear from patients being an empathic learner, empathic listener. And they said you give us time to talk, to express our emotions, our feelings, without the judgment in a non-judgmental way, and knowledgeable. And this is the word I always hear from my clients, able to giving clear expression about their illness, about the treatment, reasons, mechanism of medication, of action of medication, and the prognosis and the pathway. And so I think giving them a clear a pathway from start of treatment until the end of the treatment, I think is one of the rewarding phrases I hear from my clients. And I really appreciate this, my strong relationship with my clients. And sometimes they said, we're not coming to see you because you are a doctor, because we come to see you because we consider you as a friend. So this is something I really appreciate, without definitely that jeopardize the doctor-patient relationship, but I really appreciate that. I always tell my clients that when there's positive impact happen in their life, or positive impact changes their life, I always tell my client, it is your effort. This is your passion, your improvement. The doctors, the medication, the therapy are only tools to give you the fair chance to be yourself. So now you are fulfilling your potentiality. So it is you, not the medication, not the doctor, not the therapy. So I always tell my client, it is your achievement and you should be proud of it. This is first thing. And second thing, especially with clients with ADHD, I usually tell them, please try to think before you act. Give yourself like 2 seconds before you react. If you give yourself only 2 seconds and think about things before you act, maybe you will at least decrease or lower up to 30% of some of your impulsive decisions, only by giving yourself 2 to 3 seconds before you react. This is all I tell my patients.